to female teachers in Trans Nzoia County. The event has been sponsored also by UPET. Today we talked about mental illness, mental health, some of the causes of mental health, some of the prevalence, and we also talked a little bit about suicide. The reason why we chose to talk to female teachers is because women are naturally caregivers, and women are naturally the ones who take care of the children in school. Women are mostly the ones who take care of the men, who are mostly at the hospitals. Women are also the ones who take care of the society at large. So when we educate women and when we make women get to know more about mental illness and mental health trends, then you're most likely going to be having a mental illness. We encouraged the teachers to be able to seek for mental health guidance and to also seek for mental health treatment at the hospital. Currently at Kitale County Hospital, we have 2 psychiatrists. We have quite a number of clinical officers. We have clinical psychologists and counselors who are able to treat patients and who are able to treat them in a more holistic manner. We also encourage the teachers, even as they pick out and spot that there are young learners, both female and male, who are encountering mental illnesses, they should refer them to the hospitals for more comprehensive management. And even at the end of counseling, we usually write back a letter to the school to just tell them that this is how counseling has happened. I would like to also urge the parents at home that they should not leave the burden of mental health treatment to only the teachers. They also have a part to play. They have a part to pick out whatever they're seeing in their children and in their young learners, and also to bring that up to the teachers. We've also identified that some of the causes of mental illness for the young learners can include divorce and separation, death of the loved ones, death of the parents, death of even a teacher or even a desk mate can actually cause them to have mental illness. We need to be on the lookout for changes in various things, changes in appetite, changes in sleep pattern, changes in attention, concentration. We can look out for obvious signs like a decrease in school performance, especially in the learners. Because I said 1 in every 4 people encounters a mental illness, it means the teachers are also not immune to mental illnesses. It also calls for them to look out to symptoms of other things like suicide, if somebody is withdrawing from social settings, if somebody is talking about death in such an interesting way, talking about this photo would really look good on my funeral, then we need to know that these are some of the warning signs for suicide. If we find people are giving away their valued possessions, people are talking about that life has no meaning, that they have no hope for tomorrow. If you hear them saying things like, maybe in Swahili, mimi ni kama mfu, I'm like a dead person, or there's no hope for tomorrow, it's important to identify that and to bring them up so that they can be able to get counseling. It's important to make sure that we don't encourage people to actually commit suicide. Sometimes people say it's attention seeking, and so when we find that it's attention seeking, sometimes we want to tell them that just let's give them a rope, because they're trying to look for somebody to actually give them hope in life. We should encourage them to continue living.
Chisirem, I am Kupet Secretary Gender Trans Nzoia branch. Because of our first mental awareness day, as a Kupet Trans Nzoia branch, we decided to have the mental awareness day because according to TSC statistics, 22 teachers have committed suicide between the year 2023 and now. Because of teacher issues like job stagnation, poor salary pay, vis-a-vis rising cost of living. We have rolled out this program this year, and we have begun with lady teachers because we understand that the lady teachers are the pillars of the society. We have begun with them, and we plan to roll out to the male teachers during the year so that all of us benefit from it. The ladies are excited. The event is one of its kind. They have had the best doctor, that's the social psychologist, Dr. Dorcas Malinga, who has been very instrumental. She has explained well how to identify the causes of mental illness and how to even mitigate those illnesses. We are very happy, and moving forward, this will be an annual event. Thank you so much.
Leo tunafurahia siku hii kubwa kama chama kwa kuleta walimu wa kike kuja siku ya leo katika Mental Awareness Day ili tuweze kuangalia makali ambayo tunayapitia kila siku kama walimu na tunaweza kuyapunguza namna gani. Kwa hivyo hawa, kwa sababu ni viongozi katika shule na pia viongozi katika familia zao, ndio maana tumekuwa na hii siku ambayo ni muhimu sana kwetu. Na vile umeambiwa na Secretary Gender, it will be an annual event ambayo tutakuwa tunafanya ili tuweze kupanua zaidi. In fact, when you will come next time, utakuta namba imefika karibu 1,000 ambayo tutakuwa tuna deal nayo. So we are doing that because it has now become alarming on the issues that Gender has mentioned, that teachers are committing suicide. So depression, stress, and anxiety among teachers is causing a lot of problems, and you don't expect these teachers to be able to deliver in class or even in our respective schools. So it's a disease that we are fighting with, starting with the teachers, so that they can be able to address it together with their families, then also be able to address it together with the parents and also with the students across the board. Mnajua tuko na changamoto mingi sana za maisha, and as a result of that, hii maneno ya mental ill health imekuwa very common, and we thought as a union that we should be able to address it by beginning from where we have started, and we believe it will be addressed as we continue moving ahead. Statistics vile amesema 22 teachers who have committed suicide is the annual report of the Teacher Service Commission. Lakini as KUPPET also, we carried our own. We have all our own data that we have compiled, and for the last 3 years actually we have lost more than 100 teachers through committing suicide. And as it has already been mentioned, the reasons that we have, or causes of this, is simply low pay for teachers. Low pay for teachers. And therefore we have high cost of living. Many of them cannot meet the expectations of the families, not even themselves. And that one has become a serious issue which we feel that it should be addressed as we continue looking at many of this. Then teachers also have a lot of pressure in school. Principals, mnajua ya kwamba they don't get capitation from the national government to our respective schools are delayed. And therefore principals are left to gamble with the lives of the children because they have to feed them, they have to provide teaching and learning materials without money being provided by the government. Or if it comes late, or it is so little that it cannot be able to make any difference. That is one. Then we also have pressure on performance, because nyinyi mnajua ya kwamba walimu wanakuwa equated in terms of performing in their respective schools. Hiyo pressure yenye inatoka kwa principal, kwa walimu wanatakana wa perform, hiyo ndiyo inaleta tena tension mingi, inaleta stress mingi kwa walimu, and many of them, because they cannot hold it any longer, then we have these suicidal cases which are coming up and down. And then the biggest group that has been affected is the young teachers. The young teachers cannot hold this, especially as all teachers, we can be able to sustain it for some time. Lakini young teachers cannot hold it for long. And therefore, as we finish with this team also, we are thinking of also inviting the young teachers who are aged between 20 up to 35 and be able to sit with them on an event like this one and see how we can be able to address the problem they are undergoing right now, so that we can be able to solve it and make teaching better and also ensure that our children are able to benefit more. They take care of our children in school as mothers, apart from them being teachers. Then two, they are also mothers at home. And you know, a lot of stress and depression begins from home and comes to the working places. So they'll be in a better position to address it right from home, and then they'll be able to come and carry it over to the schools so that our children will be safe in their hands. And then we have also started with them, because majority of them are in guidance and counseling. If you went to any school, you'll be able to find the departments of guidance and counseling are held by female teachers. And therefore, they'll also be able to support the teachers who are male teachers who have issues in schools. They'll be able to address it at first hand when it happens.